In this video, I wanted to talk about postpartum depression. Um, I want to begin by adding the caveat that as a man, the observations I'm making, the insights I've had in my clinical practice are just that. Uh, they are something that I will never go through, at least as a woman or as a person who actually gives birth. The reason I think discussing this is really important is that I think there's a lot of misunderstanding and a lot of surprise when huge emotional changes occur after giving birth. And perhaps what gets lost in the excitement of pregnancy, of imagining a family, are the very real changes that can occur when somebody goes through the physical act of labor. What I have seen in my clinical practice are women, and it extends, of course, to relationships and families because these changes are central often to how people relate, to shifts in dynamics. And we really cherish our stability or our what is known to us. And so when that is altered, sometimes in very significant ways, it creates a sense of panic and terror. I have, on many occasions, discovered that individuals, women, go back to the birth of their children and identify that that's when so much changed emotionally. And what I want to focus on today isn't perhaps the joy and incredible rewarding experience of raising children, but the incredible exposure that comes with the process of having children. I routinely ask women who I am seeing in my practice what the experience of their childbirth was. And I do so because it is an experience that often forces one to have to ask for help. It is emotionally and physically demanding, and really one can't hide in that process. There are ways that the exposure can be mitigated. One might think of family or friends or people around you that can be supportive. But even when that's the case, the very private, nuanced feelings that are evoked still manage to rise to the surface. For many women and families and relationships, there isn't a crisis or negative change in terms of the family and relationship dynamics. But for many women, they all of a sudden feel an overwhelm and a pain that they didn't expect. And to then have to carry or bear that kind of vulnerability while also caring for a newborn, and possibly a newborn where you have other children already around, is an incredible task. It makes a tremendous amount of sense that being ushered into a situation where you no longer can really hide from your feelings, from others, from a newborn baby, that if one needed, for various reasons, to hide before, if one had to build various boundaries or walls around their feelings to survive, that having a child and then losing sleep, being on call 24 hours a day, dealing with the stress that this places on relationships, that would raise the stakes immediately. I often think that it would be in our best interest to prepare us for that experience, to normalize emotional needs, to assess how easy or difficult it is for somebody to reach out for help, so that we might have some indication what it will be like to be ushered into such a helpless position. But in life, we can't often anticipate these things. We're all trying to survive and put one foot in front of the other. And so sometimes we don't know until we know. And so I feel very strongly that we have a discussion about the vulnerability that's inherent in giving birth, how that can lead to incredible grief if we have had chronic childhood trauma or acute traumatic incidences, such as being sexually assaulted, if we've lost trust in our own bodies or our own feelings, then to have to be so close to them, and then to have a child who is often provoking strong emotions in us, is no easy task. And a lot of women, I feel, either suffer in a kind of silence or a kind of unknowingness, or are really surprised by the extent to which this experience changes their emotional landscape. And none of us really want to shed our skins, to shed the emotional markers that make us who we are. Having an identity that is predictable, that we are familiar with, is often the cornerstone of good mental health, that you have some understandable sense of yourself and who you are. And for some people, that is ripped away from them overnight. And they find themselves in an entirely new emotional world with nothing to hold on to, no sense of familiarity. And that's scary. And so the notion that we suffer a great deal going through the process of childbirth makes a lot of sense. And I want to again add the very strong caveat that when I talk about this, it is coming from the perspective as a man. I can certainly talk about it as a partner of somebody who has given birth. But I could never speak to it as somebody who has been through it. Only as somebody who has sat next to women who confide in me and talk about how that was a moment when so much changed. If this video achieves anything, it's to validate and normalize the disorientation that you might be feeling. You do not have to jump through hoops to pretend you're okay. You do not have to panic that somehow you are abnormal because the experience seemed like it turned your world upside down. If you can manage to reach out for help or find somebody knowledgeable or caring who can make sense more out of how the experience challenged you and certain defenses that maybe you had, then I think that's the first step. And to have a great deal of kindness towards yourself.